Nigeria detects third coronavirus new variant. Federal government urged to ban flights from the UK and other countries as coronavirus second wave hits. In international news, U.S. medical teams are hoping COVID-19 vaccines would end suffering as Pfizer agrees to supply 100 million more doses to the country. And in sport, Juventus goalkeeper faces Italian FA probe for blasphemy.
This is ANN News.
I am Olajumoke Olatuji. There was hope that new coronavirus cases in Nigeria would continue to decrease, but the onset of a second wave and the detection of a third new COVID-19 variant in the country have erased that hope. Head of the Africa Center for Disease Control, Africa CDC, John Nkesang, said on Thursday, although the new variant P681H appears to have emerged in Nigeria, further investigation is needed. There is a dangerous situation that could add new alarm to the pandemic. Similar variants in Britain and South Africa have led to the swift return of international travel restrictions and other measures, all in the midst of the world's major holiday season. Meanwhile, high numbers of infections have been recorded in the last few days in Nigeria, including the second highest number of 1,133 new cases reported by the Nigerian Center for Disease Control just yesterday. NCDC also said 395 recoveries were recorded, as well as 5 new deaths. Lagos had the highest number of new cases on Wednesday, recording 397, followed closely by the Federal Capital Territory with just 40 fewer cases. 13 other states also recorded new infections. The country's total number of confirmed COVID-19 cases now stands at 80,922. Total number of fatalities related to the coronavirus in the country has increased to 1,236. The news of a second wave and the identification of a new variant of the coronavirus in the UK has spread all over the world. More than 40 countries, many of them in Europe, have already isolated the UK as a result. Now the Health Writers Association of Nigeria is asking the federal government to follow suit and ban flights from Britain and other countries that are currently experiencing the spread of the new variant of the coronavirus. The organization said in a statement it was appealing to the government not to wait any further before taking necessary steps to stop the new variant in its tracks so it would not come into Nigeria. The new variant is said to be 70% more transmissible than the previously dominant strain, but there is no evidence yet it could be more fatal. The association pleads for federal funds for research institutes like the Nigerian Institute of Medical Research and others to develop a locally formulated coronavirus vaccine. The Health Writers Association of Nigeria is a part of the umbrella body of all health and science reporters and editors in Lagos. It is registered under the Nigerian Union of Journalists, NUJ. The problem of gender equality persists across Africa, where women are often held back by cultural beliefs and patriarchal mindset. As correspondent Kelechi Mekalam reports, world organizations say women's full economic participation could give the Nigerian economy a shot in the arm in the coming years.
Hildatu Abdullahi is from northern Nigeria, a predominantly patriarchal society. Females face cases of forced child marriages, female genital mutilation, sexual abuse, and exclusion from education. But Hildatu didn't want to be a conventional northern Nigerian girl child. She was bent on completing her education, building a career for herself, and choosing her own life partner. So she fled her home when her family tried forcing her into an unwanted marriage.
In the Hausa community, they feel getting married is like a huge achievement for you. And when a man gets married to you, it's like he's doing a favor, and which is very wrong. When you talk about being successful, you want to open a shop, you want to do this, you want to do that, the first question they try to ask you is, are you not going to get married? You're planning all this, when are you going to get married? Some parents will even stop their children from going further, from achieving more success.
Hildatu was lucky enough to find a new path, but there are millions of girls from her region and across the African continent who aren't as lucky. A new report released by an advocacy group, the African Child Policy Forum, shows that girls are condemned to a lifetime of discrimination and inequality. There are about 308 million girls under the age of 18 in Africa, yet only 1 in 5 of them had access to secondary school. Despite government's effort to close the inequality gap, much more is required from other key players.
I think we have left this responsibility to the government alone, and we know that government cannot do everything. Government can only give us policies, they can only give us framework. It's now left for CSOs, CBOs, NGOs to go to the grassroots and see how we can combat gender inequality in all its form, in workplace, in sports, in education, in schools, everywhere we find it.
According to a 2019 World Bank data, 49.33% of Nigeria's 200 million population is female. However, factors like culture, religion, violence and poverty continue to drive a girl inequality gap in Nigeria. A McKinsey report projects that Nigeria's GDP could grow by 23% by 2025 if women are given an equal chance to participate in the economy. So girl and women rights advocates across Africa are urging governments to implement laws and policies for a more girl-friendly society.
Well, it's Christmas and New Year season again, and the federal government has not failed in declaring the annual public holidays to mark the season. Although the coronavirus lockdown is already keeping some public servants at home, it is certain the special nature of the 3-day holidays this year will be pleasant. The government has declared Friday, December the 25th, Monday, December the 28th, 2020, and Friday, January the 1st, 2021 as public holidays. All of us at African News Network, ANN, wish you and all of yours a peaceful and healthy holiday.
And later, international news. U.S. medical teams are hoping COVID-19 vaccines would end suffering as Pfizer agrees to supply 100 million more doses to the country.
You are watching ANN.
The city slept. We installed a board in the middle of a park with something special hidden inside. We wondered if people would notice. They didn't, so we invited Nigerians to add their polls to the scene, whichever way they chose to. Some literally added their own polls. Some sang, others rapped, and even recited poetry. As they added their polls, the board came alive. Hidden figures broke free from obscurity, inspired by the crowd expressing themselves.
You know you can't do anything.
Because why blend in when you can stand out? NTN polls. Do you? Dial *406# to join.
Welcome back. This is ANN News. The coronavirus second wave is bearing down rapidly in South Africa. Health authorities are blaming the spread on a severe variant of the virus which was detected a few days ago. South African's researchers say details of the 501V2 variant have been sent to the World Health Organization. Correspondent Elisa Injamela reports.
The The Health Ministry strongly suggested that the current second wave being experienced here in South Africa is being driven by that variant.
This new addition to the family is quite a black sheep because we do not know what this new variant is going to do. What we do know is that it can change itself or mutate, and it's got 3 mutations. First one, predominantly, in the first wave, we predominantly saw it was elderly people and people with high blood sugar and cholesterol. Now this black sheep that now comes into play here, or the new variant that comes into play, unfortunately also go for young people. And what we have seen, especially in the ICUs, the people who admitted is not only anymore your elderly patients with non-communicable diseases, but it is young people.
The health fraternity is now extremely concerned.
We are very, very worried. Again, because what we have seen is that the curve goes straight up. It doesn't slowly goes up, it goes straight up. It's a problem. It means the infection is much more virulent. Again, we have, during this time of the year, there's a lack of doctors. Everyone, or most of them, are on leave. So there's skeleton staff.
Government has now issued a stern warning against organizing and attending festivals, sporting events and mass gatherings. These events.
Kenya's tourism industry is experiencing an upbeat holiday season as hotel bookings and visits to the country increase despite the raging coronavirus pandemic. As correspondent Nick Mudimba reports, many in the hospitality business are pleasantly surprised.
The Sawela Lodge, an increasingly popular holiday destination in Naivasha, Kenya, where signs depicting the festive season welcome visitors upon arrival. It's clear that business here is slowly getting back to normal as more guests check in. The hotel's management has been pleasantly surprised by the increase in visitor numbers, but it insists that observing the Ministry of Health guidelines remains their top priority.
As we prepare for festive period, we have put in place measures which will actually safeguard all our guests staying with us against the COVID-19 pandemic. We have also been certified by Public Health, and I must say we are doing pretty well in terms of the measures we've put in place.
The expanded dining area captures the surge in the number of guests. The chefs are also busy preparing delicacies specially ordered.
Compared to other years, this year, from the time we reopened from the COVID-19, business has been booming for some time, and we've actually been operating at occupancy levels of more than 65%. So surprisingly as well, for the meeting rooms, they are all fully booked.
The rooms have to be well maintained to ensure they meet all the required health standards.
Before we reopened, we actually brought in staff members and did some training on the COVID, which was actually conducted by the Public Health Office based in Naivasha. They actually gave us guidelines. Everybody was trained and they know how to handle themselves during this pandemic.
2020 has been a difficult year for many Kenyans, and the festive season has actually offered an avenue to unwind. Hotels here are actually booked at 90% capacity, something that many didn't expect, but it's all about the mind, relaxing, hoping that 2021 will actually offer a good platform and a softer landing for so many who've seen the COVID-19 wrath in 2020.
Algeria's homeless persons are facing a double-edged sword, fighting against COVID-19 and how to survive the cold weather. During the country's current lockdown, homeless persons find themselves isolated and locked down outside. Now, humanitarian organizations are mobilizing all human, material resources and equipment to help this group with shelter, food and medical care, without which humanitarian organizations say the homeless face double jeopardy, COVID-19 and cold weather.
When we return, international news. U.S. medical teams are hoping COVID-19 vaccines would end suffering as Pfizer agrees to supply 100 million more doses to the country. And later, sport. Juventus goalkeeper faces Italian FA probe for blasphemy.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. The United Kingdom has reached a deal with France to allow traffic through their shared borders that have been shut amid concerns over a new coronavirus variant in the UK. Freight drivers and some passengers will now be allowed through if they present a recent COVID-19 negative test. More than 2,000 trucks were stuck in Kent since the borders were closed on Sunday. National Health Services test and trace staff and the military will be deployed for testing. Planes, boats and Eurostar trains have resumed on Wednesday morning. Under the agreement, admittance to France will be granted to those traveling for urgent reasons, including Holland's French citizens and British citizens with French residency. But in order to travel, you will need to have obtained a negative test result 72 hours before departure. Now that the Pfizer coronavirus vaccine has been cleared for emergency use, frontline healthcare workers across the U.S. are days away from being offered the shot, and the United States government will ultimately pay Pfizer a total of about $4 billion for 200 million more doses. Correspondent Dan Williams has the details.
A small but potentially significant moment in the fight against COVID-19. As 5 staff members of the New Roseland Community Hospital in Chicago receive a vaccine for the virus. But not everyone at the hospital is ready to take that step. A quarter of the staff has indicated that at this point they have reservations.
They're afraid because it's a new vaccine. They're worried about the side effects of it.
Jill Jean is a chief nursing officer. She hopes that by taking the vaccine herself, she can help dispel those fears.
I'm really ready for this pandemic to be over. I'm ready for my workers to stay safe and be safe. I do sense some fear though, and as their leader, I feel that me taking the first step will inspire them to see that it'll be okay.
The mistrust in vaccines at the hospital underlines the work that lies ahead to educate the wider community.
It takes some convincing sometimes, but we're prepared to do that. We start with our employees and then we take it to the community.
Much of the Roseland area on Chicago's far south side is considered both a food and health desert, void of fresh produce and accessible medical care. The neighborhood suffered a COVID-19 death rate 67% greater than the citywide average. Local lawmakers are hopeful they will get equitable access to vaccines.
It's always a concern that communities like mine won't be a priority because we were hit the hardest. So the vaccine should go into the communities that were hit the hardest, and if that's not the case, then that will be a problem.
This is still the immediate focus for staff at this hospital. This 10-bed intensive care unit has been overwhelmed with COVID-19 patients for weeks, and there are real concerns that crisis conditions will only further intensify until vaccines are widely available.
Tanisha Brown is a critical care nurse in the hospital's ICU.
This is nothing that I've ever seen before. Watching patients die alone or go from being stable to now unstable in a matter of minutes has been very, very, very draining.
Brown hopes the vaccines will bring an end to the pandemic and reduce the impacts on frontline medical staff.
I'm hoping that, everybody can be on one accord, that we can have at least, 80% of the population, just go ahead and just do it. because we're tired. Healthcare workers, we're tired, and everybody else can go about their life, and we can't.
The fight against the virus continues. In this community and many others across the US, the impacts are clear, but there is now light that the end is potentially in sight.
Qatar has launched a free coronavirus vaccination campaign after the first batch of the vaccine arrived in the country on Tuesday. The vaccine will be administered in 2 doses, 3 weeks apart, at 7 primary health centers in the country. The elderly have been prioritized along with people with multiple chronic conditions. Key health workers will working closely with COVID-19 patients. The first vaccination phase will run until the end of January. The government says it expects to have enough vaccines to cover the country's entire population in 2021. Qatar has tested more than 1 million citizens since the start of the pandemic, almost half of its population. A research team in Valencia is pioneering the use of genome sequencing to help track the spread of COVID-19 in Spain. Correspondent Ahu Pathak has the details.
Spain was one of the worst hit countries in the world during the coronavirus pandemic. A new research study by the Institute of Biomedicine in Valencia has used genome sequencing to find out exactly how that happened.
We have a tool that was not present even for 5 years ago that we can now use to fight epidemics. And I think this is going, and particularly you get this real-time fighting, that's key. And I think, you think in the history of how we fight diseases, in the 19th century we have a huge development where vaccines. In the 20th century we have antivirals and diagnostics. And I think in the 20th century, in the 21st century, we will get this genomic epidemiology.
What scientists here have discovered is that there was no real ground zero for the pandemic here in Spain. It was more like lots of little fires cropping up all around the country at the same time. Those little fires joining together to create one giant inferno which enveloped its entire nation. Their research showed that after the summer, the spread of 2 variants from Spain were responsible for huge infection across Europe, in some cases up 80% of those infected, like the UK. The ability to track this mutation so accurately is the result of genome sequencing technology. Inaki Comas and his wife Lucia form part of a team that are at the forefront in their field globally. Machines like these can split the bacteria into millions of elements, which can then be fed into their database to look for distinctive patterns. Real-time sequencing does require huge investment, but it also allows the scientists to keep pace with the rapidly changing mutations in pathogens like COVID-19. It's a powerful weapon against a formidable enemy.
Up next, sport. Juventus goalkeeper faces Italian FA probe for blasphemy. Please stay with us.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. In sport, Juventus goalkeeper Buffon is being probed by the Italian Football Federation for allegedly using a blasphemous phrase during a league game. Federal prosecutor Giuseppe Cine opened the investigation of an audio recording after 42-year-old Buffon was overheard last weekend. Former Italy captain Buffon, who is also the oldest player in the league and holder of the record for Serie A appearances with 653, had once apologized for allegedly uttering the same word. A group of former English footballers and politicians has sent a letter to Culture Secretary Oliver Dowden calling for a review of a possible link between head involves and dementia. 5 members of England's 1966 World Cup winning squad have been diagnosed with dementia, including Noble Steels, who died in October. That's Arizona News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening and Merry Christmas.